How many doses of the vaccine are you expecting initially, and how will those initial vaccines be prioritized and distributed, including the more rural parts of the province?
Yeah, so we've been working on this for quite some time. I don't have the exact numbers today. I have a good idea of what we're looking at. We have been working on exactly where they'll go. Understand, though, the first vaccine that we'll be receiving is the Pfizer vaccine, which means it has to be kept at -80. So there are limited places that we have the equipment and the ability to do that. So we will be receiving small amounts to start with across the country, and we will be focusing on those most at risk. And for us in British Columbia, that is people, particularly healthcare workers who are working in long-term care and on the front lines in our health system, in emergency departments, ICU, medical departments. But we will be providing more detail about what we see rolling out, not just next week, but in the coming weeks and months, and where people may find themselves in the rollout of vaccine. So this is the beginning. We're putting all the details together, and later this week, with the Premier and Dr. Ross Brown, will be having a more detailed briefing for everybody, for the public and for you, and we'll have a lot more details by then. I will tell you as well that we're participating this week, starting as part of it has started already, but starting tomorrow as well in a trial run of receiving the really specialized containers that come from Pfizer. They won't have vaccine in them at this point, but they will have the dry ice, and we'll be going through all of the procedures that are needed to safely handle these very fragile vaccines. So it's exciting. We are expecting that Health Canada will hopefully come out with what we call a notice of compliance in Canada, which is a license for the vaccine to be used, and we'll be ready to put immunization into people's arms as soon as we can. We are not going to have enough in the first few months that it's going to make a difference in community transmission. So that's why we all have to be continuing to follow our COVID safety plans. But we will be able to protect those people who are more likely to end up in hospital, who are more likely to die from this virus, and also to protect our health care system by ensuring that people who are at risk in our health care system are protected too. So that'll be the focus to start with, and that's why it's such a challenge for us now. But that light at the end of the tunnel is there. And we need to do our piece to keep our rates low so that we prevent people from dying until we have this protection for them here in our communities and across the province.